We will now start the debate. I would now like to give the floor to the rapporteur, to Ms. Véronique Trier-Lenoir. You have.
Please.
Madame la Présidente,
Madam President, Commissioner De Stella, colleagues, for those of you who are still with us, the COVID-19 crisis showed how extraordinarily fragile we are as far as health is concerned. In 2020, our national health systems were overwhelmed, and the impotence pushed them to establish national protection measures. And we have to say we must never do that again. Now, very quickly, that initial reaction gave place to solidarity and coordination at European level. And we really have to draw inspiration from that remarkable reaction, but it was rather improvised given the urgency. After long months of fruitful negotiations, I am proud as rapporteur to be able to present to you today the major points we stood up for in order to learn lessons from the past and make this regulation a genuine health emergency plan for Europe. Colleagues, please pay attention to this notion, or at least respect it. We are stronger if we stand together, and it's together that we have to work together for a solidarity-based, coordinated, independent and lasting health Europe. Solidarity-based, fighting against inequalities within the Union by bringing about cooperation between member states, by strengthening cooperation with third countries, particularly the weakest, and by consolidating global coordination and cooperation, particularly through our international treaties on pandemics. A coordinated health Europe, coordinated in collecting and sharing data, which has often been lacking, coordinated in preparing for all health threats, taking on board a global health principle as well as the principle of prevention and health education in all European policies. Coordinated in order to better prepare and preempt the impact of a health crisis on those suffering from chronic illness. I'm thinking in particular of the many collateral victims amongst cancer patients. Coordinated, finally, in order to fight against disinformation, basing ourselves on the ECDC as a relay for scientifically proven information. Independent Europe, as far as medicines are concerned, we want more transparency vis-à-vis the European Parliament and the citizens in drawing up joint procurement contracts. We have taken on board the idea of an exclusivity contract to avoid in parallel negotiations with industry and to have fair access to medicines for all European citizens. We ask for HERA to have the measures, the means to better coordinate with the various bodies. And we want evaluation to see whether or not this body should become a separate body. And finally, a lasting health Europe, the setting up of an independent health council, provisions to avoid conflict of interest amongst experts, consultation with all other stakeholders, NGOs, health professionals, on an equal footing with industry, strengthening the role of the Parliament and therefore of citizen representation, and finally the involvement of regional authorities in order to enhance cooperation in cross-border regions. These are major breakthroughs which couldn't have been achieved without the mobilization of my very dear co-rapporteurs, women, They were anything but shadows. And my thanks to them and to their teams before the floor goes to them. Thank you.
Bardzo dziękuję. Pani poseł, głos zabierze.
Thank you so much. And now the floor goes to Ms. Joanna Kopcińska. You have 4 minutes.
Dziękuję pani przewodnicząca.
Thank you. Dear Commissioner, ladies and gentlemen, after nearly 2 years of legislative work on the European Health Union package, we are now starting the approval process of its 2 key elements, a reinforced mandate for the European Centre for Disease Prevention and Control, ECDC, and a regulation on serious cross-border health threats. These both regulations are complementary and they share a common goal: to prepare us as best as possible for possible future health crises, to ensure consistency in prevention efforts. The reinforced ECDC mandates, which I had the honour to negotiate on behalf of the Parliament, is an extremely important link in our collective health system, along with the regulation on cross-border health threats. This is the one on which I worked as a shadow rapporteur for the ECR group. The COVID-19 pandemic was a tough, but to some extent valuable experience for national health systems. It was an extreme lesson in sacrifice, solidarity, and resourcefulness. Above all, the pandemic crisis has highlighted the importance of responding quickly at the local level to disease outbreaks. It has also demonstrated how important proper training of medical personnel and management of member states is, especially in terms of the development of national action plans. Therefore, the ECDC's reinforced mandate, there will be a special role that will be played by the EU Health Task Force. It will play a special role in developing, analysing and updating member states' preparedness plans. In addition, we have seen how important digitalisation in public health management is. We hope that effective digital platforms for epidemiological surveillance will be developed. Epidemiological surveillance systems will also be strengthened by a network of functional EU reference laboratories, as well as microbiological safety networks. The pandemic, and especially its first stages, when we were still navigating in the area of many unknowns, it has revealed the need for close coordination between the EU and the World Health Organization. So I am pleased that this negotiated mandate will help better align and coordinate EU recommendations and actions with those of the World Health Organization to ensure their consistency and complementarity. As parliamentary rapporteur, I have also worked to ensure that the ECDC mandate support but not replace national public health efforts. It is necessary to respect the principle of subsidiarity at the EU level in such a way that the EU supports and coordinates the actions of member states, where action at the national level alone would be ineffective. I believe that the negotiated text has ensured the balance of competences and entrusting the centre with additional tasks keeps up with the requirements of our times. No country can face a public health crisis of a cross-border nature on its own, so I fully support the proposed increase in ECDC's mandate to monitor epidemic threats in the EU and recommend countermeasures. Within the framework of regulating cross-border health threats regarding the comprehensive legal framework for the EU's preparedness and early warning activities. While thanking all the shadow rapporteurs who worked on the ECDC report, thank you for your excellent cooperation and many valuable comments during the negotiation process. I would like to ask for your support. At the same time, I would like to congratulate the rapporteur on the regulation on cross-border health risks, Ms. Véronique Trier-Lenoir. Ladies and gentlemen, I am convinced that we are guided by the same intentions. We want a better level of health protection for our citizens, more robust health systems, and, in times of crisis, consistent and effective action. Thank you.
Dziękuję bardzo.
Thank you so much. And now, Commissioner Stella Kyriakides on behalf of the Commission.
Thank you, Chair. Honourable members, first of all, I would like to start by expressing my great appreciation to this House for your support into turning the European Health Union proposals from ambition into reality. This strong European Health Union, for many of us, has been a vision that we have shared. In November 2020, we presented that ambition, a set of proposals to build a strong European Health Union and to make the European Union better prepared to prevent, to prepare for, and to respond to cross-border threats of health. In less than 2 years, we're gathered here for the final steps in the adoption on serious cross-border threats to health and the regulation extending the mandate of the ECDC. Both serve as very important building blocks for our European Health Union. Both fit neatly together with the other important pieces of legislation for the new European Health Security Framework. Thanks to our joint work, we will extend the European Centre Disease Control and Prevention's mandate. Now, what will this actually mean? A stronger ECDC will be able to issue recommendations to Member States regarding health threats preparedness. It will be able to host a new network of excellence of EU reference laboratories and to establish an EU health task force for rapid health interventions in the event of a major outbreak. As we have all witnessed, the ECDC has been essential in making sense and in managing this pandemic. With a stronger focus, we will be better prepared for the future. The new regulation on cross-border threats paves the way for a stronger EU role in preventing, preparing and managing health threats. You have been instrumental in delivering on citizen expectations for more EU in the area of health, something that we have also heard consistently in the Conference for the Future of Europe. Honourable members, Parliament has fought hard to have some key elements included in this package. And I need to especially extend my thanks to the rapporteurs, Honourable members Kopczynska and Triel-Lenoir, and of course their whole teams for this. We have worked together tirelessly to get here today. You have each played your part in securing the provisions on joint procurement of medical countermeasures. You supported inclusion of the One Health approach. You made sure that prevention featured alongside response and preparedness activities. With your support, we made sure that Member States will have to report on stocks of critical medical countermeasures. They should take account of the Union Preparedness Plan and will develop when updating their national plans. And ECDC is empowered to access those national plans periodically on top of periodic reporting to Member States. Meanwhile, the EU's Health Security Committee will be reconvened at senior level and will be able to issue recommendations and opinions. And with Parliament's new observer status secured, I am pleased to say that this committee is even stronger. I must mention that the Commission does maintain some institutional concerns on both texts and will be issuing statements on these accordingly. In ending, honourable members, this debate gives me the opportunity to really thank you again for your support, to bring this package today and to work towards its adoption. And as we move into the implementation phase, we'll be taking further important steps together to turn this into a reality, because this can only mean better results for our citizens, and this is what they rightfully expect from us. Thank you.
Bardzo dziękuję.
Thank you, Commission. And now on behalf of the Committee on Budget, José Manuel Fernandes. You have 1 minute, sir.
Madam President, Madam Commissioner, ladies and gentlemen. It's our obligation to do everything to protect citizens and allow them to live in better conditions. We have to coordinate and share, and therefore we need a union of health covering purchasing and joint distribution of vaccines. This means that we can have vaccines for the weakest. This coordination is essential within research. We can do more there when it comes to particular areas. And we've also defended Europe coming together to fight cancer. Transparency is absolutely essential. I would add the possibility, when an examination has been carried out in one country, so that it could be used in another. It would be an addition in terms of efficiency, and it would save resources. And all the things that I've mentioned have to be done together so that we can catch up with the delays in the pandemic. In my country, Portugal, there has been an excessive mortality rate above the European average. Thank you.
W imieniu Komisji Rynku Wewnętrznego.
Dziękuję. Thank you so much. And now, Kim van Sparentak from the Committee on the Internal Market.
Thank you. Dear colleagues, I would like to comment in particular on procurement, which is within the IMCO remit. I welcome the provisions where our IMCO opinion was improved in a practical way. For example, the EU exclusive procurement, meaning that countries would not be able to negotiate with different manufacturers in parallel. For this issue, a great compromise was found, which is that only after assessment it is decided if it is an EU exclusive procurement. And this makes sense, since the EU exclusive procurement would be beneficial regarding countermeasures involving plenty of options on the market, for example with tests, but would not be beneficial for other measures where there might be a shortage, for example with vaccines. Looking at the final text, although we certainly did not get everything we wanted from the Greens EFA and IMCO side, I still welcome this regulation, which will surely contribute to strengthening the Union's coordinated response to public health emergencies. Thank you.
Bardzo dziękuję.
Thank you so much. And now, on behalf of the Christian Democrats, the floor goes to Mr. Radan Kanev. 1 minute and a half.
Благодаря, госпожо председател. Уважаеми колеги, важно е да подкрепим.
President, Commissioner, colleagues, it's very important that we support this interinstitutional agreement in order to have a common policy on transmissible diseases in Europe. It's the possibility to defend our freedom in a free market, our greatest achievements, but also at the same time to protect our citizens against future health crises. That will also give us the possibility for science to work with data from over 500,000 people. The processing of this data shared between all of our states would make it possible for the EU to play a leading role in medicine and thereby to best protect its citizens. And that's the way it should be. To conclude, I would stress that it is particular importance that the greatest achievement of the Parliament should be followed up on in these interinstitutional agreements. In other words, by creating the link between chronic and communicable diseases, because it's very important to establish that link between severe chronic disease.
Thank you so much. And now, on behalf of the Alliance of Socialists and Democrats, the floor goes to Ms. Sara Serdash.
Thank you, Madam. Some 2.5 years ago, the European Union was threatened by a pandemic which affected every single one of us. We responded with the instruments which we had at that moment in time. But if we feel the need to build a true European Union of health, it was at that moment in time. So this regulation was discussed after months of negotiations in order to deal with health in all politics and all policies. Health is a part of any prosperous society. This regulation takes into account the prevention plans and response plans at national and European level, recognizing health emergencies in the public health sector, more coordination with international organizations such as the WHO. Crises don't know borders. We have information at all levels for health professionals, more transparencies, reference laboratories, distribution of the burdens for those who manage these crises, with multi-sectoral approaches and fight against disinformation, against fake news. This is a robust mandate that we have because crises are stronger if we are weaker. I'd like to thank all of those who have made this possible, the Commission, the two presidencies that have worked with us, you, Veronica, and all of those shadow rapporteurs, because they have certainly met the challenge for a European Union of health. Thank you.
Thank you so much. And now on behalf of Renew Europe Group, the floor goes to Mr. Nicole Stefanuța. 1 minute, sir.
Dziękuję Pani Przewodnicząca, Madame la Commissaire, cher Veronique. Cât să mai fim pacienți de mâna a doua? Cum e...
Thank you. How much longer are we going to be second-hand patients? Imagine being ill and knowing that in Belgium you have immediate access to treatment, but in Romania you don't even have a free bed in a hospital. There are no syringes, no soap, no toilet paper, no disinfectants, no drinking water. Sometimes you need to buy medicines, bring them from home into the hospital. In my birth town, Sibiu, people need a hospital so much that they already have the design. All they need is money to build it. Let's send the money promised for health where they are most needed. There have been 2 difficult years, 2 years of pandemic in which the European Union was brought together closer than ever. And the ECDC was the real shield for life and for health. But the agency needs us. It needs new money. It needs new resources. It needs new people. And now is the time to help them. We cannot continue like this, knowing that some Europeans have access to medicines and others don't. Some people live and some people die because they don't have access to medical care. We want the European Health Union now.
Thank you so much. And now the floor goes to Ms. Margarete Auken on behalf of the Greens. 1 minute, please.
First and most importantly, thank you for good cooperation with a competent negotiating team. We Greens have focused on a health-oriented view of health. If nature and the environment are threatened, our health is threatened too. Worsened biodiversity and increased pollution are a general health risk and increase the risk for new pandemics. That joined-up thinking has now been taken on board. We would have liked to see more transparency when it comes to joint purchases and negotiations with the pharmaceutical industry. Taxpayers have a right to know how their money is being spent. We got a little bit of openness in the decision-making process by having parliamentarians at various levels. This means that citizens have a chance to keep up. If governments are left to themselves, there's very rarely openness in the same way as we have in Parliament. But what about global solidarity? It's shameful for the industry that they have received billions of euros for developing vaccines and will continue to be well supported by the public sector, that they are opposing sharing both knowledge and the formula for vital medicines. And that is shameful that the governments are coming down on their side and not on the side of people.
Pani poseł w imieniu Grupy Tożsamość i Demokracja głos zabierze pani poseł Mathilde Androuet.
And now the floor goes to Ms. Androuet. 1 minute.
Il y a une certaine ironie à plaider.
It's a little bit ironic to call for more and more Europe when the European Union has proven itself incapable of doing things better, particularly in reacting to the crisis. The COVID crisis, well, we said that we had the most effective solutions, but they were the best ones were actually neighbourhood ones. So these are for the sovereign states. The Union is more removed from patients, and even European parliamentarians couldn't have access to the vaccines. Now, you remember the serious cross-border threats, and why don't we put the borders back? That'd be a first line of prevention. We don't want to see the pharmaceutical industry going out of Europe, but we have to be worried by the fact that 80% of the active principles in our medicaments come from India or China. I think it should be up to the member states to manage their own health services, and for the European Union to look at research polls so that they can then support member states in their work.
Thank you. And now, on behalf of the European Conservatives and Reformists Group, the floor goes to Margarita de la Pisa Carrion. 1 minute, please.
Presidente.
Madam Chair, Commissioner, Stella, colleagues, the COVID crisis has been full of mistakes, and there was lack of transparency, both on the part of the work made by the Commission. These proposals are going to make it possible to be more agile in reaction to crises. If we improve the health instruments, should not be an excuse to introduce policies orchestrated by the Commission, and then the Member States have less policies to implement. If you're going to coordinate, you're not going to be introducing unilateral measures or to get rid of mechanisms that exist in national countries. The pharmaceutical reform at European level will show us whether we have worked together and whether we're respecting competences, benefits for European health of European citizens, development of industry, and the autonomy of supply. Thank you.
Thank you so much. And now, on behalf of the left group in the European Parliament, GUE NGL, the floor goes to Ms. Katerina Konečná. 1 minute and a half.
Thank you, Madam President, Commission, colleagues. By adopting these two regulations, we are completing work which started during the pandemic of COVID-19. I do have serious objections to all three documents, but I do believe that their timely and smooth implementation will make it possible to prepare for another pandemic which is bound to come. Unfortunately, the legislation as adopted is fairly limited, and it's based mainly on the fact that the primary law of the EU does not cover cooperation between member states in the area of healthcare. In the long term, this is something we need to change. Cooperation in the area of public health and care deserves a major amendment in the treaties. If that doesn't happen, we will be forever just patching up gaps that continue to come up. However, I'm now looking towards a review of the pharmaceutical legislation. That might help us moderate the problems in the European healthcare and its accessibility, which was only uncovered by the pandemic. For decades, the Commission still hasn't submitted this review. We don't have much time in this mandate. The current framework, both for general pharmaceutical legislation, intellectual property rights, or rare diseases drugs, or cross-border healthcare, can't keep up with the demands of the time. There are more and more differences within the EU, and we can expect that the current crises will only accelerate these problems. It's 5 minutes past 12. It's time to start doing something, especially for EU citizens.
Thank you so much. And now the floor goes to Laura Ferrara on behalf of non-attached members. 1 minute, please.
Grazie, Presidente.
Thank you, President. With the COVID-19 pandemic, member states understood the importance of improving common responses to health emergencies which go cross-border, strengthening cooperation at European level will make it possible to have more effective coordination to prevent and prepare for managing not only infectious diseases, but also various threats to public health, which come from the environment, from our health, neurological and chemical threats as well. The ECDC will be a fundamental player in monitoring, analysing and providing consultancy. The availability of adequate health services accessible to all should be a priority in national and European planning. Every effort should be undertaken to reduce our dependency on third countries for pharmaceuticals and medical equipment. Transparency and participation have to be part and parcel of every decision-taking process, as well as in our negotiations with industry. The more solid the European health situation, the more protected the health of our citizens.
Thank you so much. And now the floor goes to Esther de Lange.
Thank you, Madam. Well, a minute is simply not enough for you to understand the results of this negotiation. Thank you, Veronique, and can I thank all the members of our team. We did come from different political groups, but we did have common priorities, and I'd like to thank you for this in this very brief period of time. I would like to say the three things of which I am proud, because continuity of care, this is something that has to be taken into account in the plans of the member states. If you look at the reports, I mean, the fact that diagnoses which are too late, especially cancer in children, is something that is so important. But I don't like the fact that mental health is not taken on board in national preparation and preparatory plans. We wanted this, but Council prevented us from getting this into this package. We need more attention for this. You just need to look around in Strasbourg. And what I fear mostly, that during the next pandemic, Council is going to go back to the national reflex. But citizens don't really want this. This particular legislation makes it possible to have a European approach, and I do hope you support the vote during the vote this week. Thank you.
Thank you. And now, Ms. Helen Fritzon, 1 minute, please.
Tack, fru talman, kommissionär.
Thank you very much, Madam President, Madam Commissioner. The pandemic isn't over yet, but in the EU, because of vaccinations, hopefully we have the worst behind us. A European Health Union, the Health Union will get new instruments to make sure that COVID mutations or an unknown virus becomes a new pandemic. If member states get information and share it in good time and can be one step ahead and introduce local restrictions before the virus spreads, the EU provides protective equipment, and if a particular country has run out of equipment, another country can help. So we can also fight disinformation and resistance. Viruses know no borders, so I look forward to better coordination so that we can get over the future virus.
Thank you so much. And now, Ms. Irena Joveva, 1 minute, please.
Lepo pozdravljeni, kolegice in kolegi.
Dear colleagues, dear Commissioner, health is the basis of everything. If there is no health, there is no economy, no school systems, no social security systems, no politics, nothing. As long as we're healthy, we like to forget about it in our everyday lives. But 2 years ago, we were all given a clear warning, a warning that showed how very vulnerable member states are when fighting crises of such magnitudes. Cross-border and public health threat management depends on numerous elements. Number one, we need to strengthen the mandate of ECDC. If we want the ECDC to do its job, data collection and processing needs to be digitalized, but in a safe manner. Treatment quality And medicines accessibility should not depend on the member state where you live in. That is why we need common standards and the implementation of such standards, perhaps even common public procurement of medical products that should be done through EMA. But the most important is to have an efficient healthcare system, because none of us know the future. And as I have said, health is the basis of everything.
Thank you so much. And now, Tilly Metz, 1 minute, please.
I would like to start by congratulating my colleagues for their work on these two dossiers, which I think lay the crucial bases for strengthening coordination within Europe on health issues. However, I'm a little bit divided. Health Europe should be in line with the wishes of our citizens for Europe. It's social Europe that they're calling for. However, once again, the Council and the Commission have somehow limited the call from the Parliament for more transparency and systematic insight into the public money which is spent. Transparency should not be a battle. It should be a recorded process. And it bothers me that after so many calls, our heads of state aren't recognizing that. Changing Europe, strengthening it, starts by building a Europe in which we trust. And transparency is crucial to achieve that. Thank you.
Thank you so much. And now, Joachim Kuss, 1 minute, please.
Thank you very much, Madam President, Madam Commissioner, distinguished colleagues. The proposals to strengthen the ECDC in the two reports sound good. Nobody's against it. Being against better prepared for future pandemics and cross-border health threats. So why can I not overcome the feeling that these useful reasons for strengthening the ECDC are just further steps towards total collection of health data of all citizens, a sort of borderless surveillance system a la China. After Ms. Galina, the General Director, said in the Budget Committee 2 weeks ago that she has issued about 1 billion COVID certificate, then I can't laugh at all. So put this task back into the hands of the Member States, Madam Commissioner.
Thank you. And now, Mr. Antoni Comini-Olveras, 1 minute.
La pandémie nous a obligés, en tant qu'Union européenne,
Well, the pandemic has forced us to take a step forwards in the health sector, and that's what we've done, a health union. And these regulations have specific rules, and we're very pleased after the last trialogue. There are certain proposals that we tabled that will be included. Regional authorities will participate in the development of preparation plans across borders. The governments, such as the Catalonian government, and where I was a health councillor, we have a lot to say in this sector, but there is a lot more in this regulation, the holistic approach for these preparation plans. They will take account of the impact of epidemiological threats on mental health and other non-infectious diseases. And the pandemic has made us understand that there is a link between human health, animal health, and environmental health. And the principle, health in all politics. How can we start preventive politics if we don't understand the crucial role of social services? So this regulation is good news for the right to health of European citizens, and we're very happy. Thank you.
Thank you so much. And now, Peter Liese, 1 minute, please.
Liebe Kolleginnen und Kollegen,
Colleagues,
es sagte der US
the pandemic is over. That's what US President said. But then he added, but we still have a problem with COVID. Now, Joe Biden is quite close to a realistic assessment of the situation, I would say. We're now in a much better situation than we were in 2020, 2021. Different virus, high level of protection with an excellent vaccine, which, with the help of the European Union as well, has been developed and produced and made available. A lot of things weren't perfect, but we shouldn't lose sight of the fact that we're now in a much better position, also thanks to the action of the EU. Now we can focus on the other concerns of people, and we have to do that because these other problems, for example, in the energy sphere, are very serious. These two texts before us, I think, will mean that next time, if something happens again like this, we're going to be better prepared. And thanks to all of those who have helped, particularly Esther Delana and Radan Khaned for the EPP. And if we look towards China, we can see that the problem isn't over yet. So Europe hasn't done that badly after all.
Thank you so much. And now, Mr. Günther Siedel, 1 minute.
Sehr geehrte Frau Präsidentin.
Honourable Madam President and Commissioner. Well, the pandemic has clearly shown that a member state on its own is not fully capable of dealing with this. In a common crisis, we need more solidarity, more cooperation. It's also been indicated that the European Union didn't have enough competences. People looked at Brussels to find solutions, to find answers, but Europe did not have enough room for manoeuvring. We need to change this. Today, with this regulation, we are taking a step to be better prepared for future pandemics. And this will help by investing in research, in development, and to reduce our dependency and to go on with common procurement. We need to get strong public health systems in Europe, and you are the anchor for people in times of crisis. So we need to think about health protection for all. Thank you.
Thank you so much. And now, catch the eye. We have 5 minutes. And four persons. You have each 1 minute. First, Mr. Stelios Kinkiropoulos.
Thank you, Madam President. Dear colleagues, as COVID-19 pandemic evidenced, there is currently a limited legal framework for EU-level coordination to serious cross-border threats to health. We need a timely common EU-level response to harmonise risk communication and ensure solidarity among member states. The presented proposal sets a stronger and more comprehensive legal basis for the EU to prepare and respond to future crises. In my view, to sufficiently to do so, we should guarantee that every EU citizen has equal and easy access to all healthcare systems among the member states, especially when moving freely from one state to another. Moreover, as most of the consequences after a serious cross-border health threat have a great impact on mental health, we should invest on protecting our citizens' mental health by outlining a legislative framework that provides for mental well-being and support. Dear Madam Commissioner, let's use the lessons learned from COVID-19 to enhance and embrace EU guidance on preparedness, surveillance, risk assessment, and early warning, supported by improvement data collection tools to better respond to a future cross-border health threat. Thank you very much.
Bardzo dziękuję, panie pośle. Głos zabierze pan poseł
Thank you so much. Dominic Ruiz de Besa, 1 minute, please.
Muchas gracias, señora presidenta.
Thank you, Madam President. And thank you also to the Commissioner present with us and to our colleagues who've worked on these two documents, which are absolutely crucial because they're the two major pillars of the Health Union. A project which obviously got the get-go because of the pandemic. The Commissioner said that she made a proposal in November, I think, of 2020. note of criticism there. I think it should have been done beforehand as well, but all's well that ends well. But in April this year, the Spanish socialists, Javi Lopez, César Ruena and myself, we asked the question of the Commission about the health union, and we've heard another proposal along the same lines in May. But anyway, now we're in a situation where we can move ahead on this health union and make the best of it, because, as we've said, the pandemic is not completely over yet, and the scenario will be that we will have to update annual vaccination campaigns for the whole of European society.
Thank you. Mr. João Pimenta Lopes, 1 minute, please.
Obrigado, Sra. Presidente. Sejamos claros do que estamos a falar.
Let's be clear. Here, it's about a market for health in the EU and privatizing the sector. There is a privatization of healthcare systems. And there have been specific recommendations for countries from the come from the Commission. You've been recommending cutting down healthcare systems, and member state competences are being transferred up to the supranational level. The poor are losing out. It's the big financial groups that are benefiting. Health is a national competence. It's normal. It's about guaranteeing public services of a high quality, universal services with investment in the sector, so that there can be health close by, and having proper health conditions for health workers.
Claire Daly, 1 minute, please.
Thanks very much, President. And I think while there is certainly a need to improve and deepen European collaboration in order to prevent, monitor and respond to cross-border health threats, I think COVID, more than anything, has highlighted actually the harmful consequence of neoliberal policy adjusted to the health sector and promoted in the EU. The commodification of healthcare is assaulting the principle that health is a fundamental right, and we see in countless states institutional abuse, lack of materials, exorbitant prices and the priority given to profit. And where is this coming from? It's coming from the Commission. We know that many member states have been directed to slaughter their health budgets in order to balance the books, and we saw those devastating consequences then in COVID, when people and economies had to be basically shut down. People were locked in nursing homes, nobody could visit them because of the fear of what would happen if there was an outbreak of COVID and the hospitals couldn't cope. So we need to ensure that health is immune from the laws of the market. Health should be a fundamental right. Thank you.
Thank you so much. And now, on behalf of the European Commission, the floor goes to the Commissioner, Stella Kyriakides. The floor is yours, Commissioner.
O co chodzi? Nie mam w wykazie pani poseł.
I am sorry, but I do not have you on my list.
Said yes, and you have to behave fair in this procedure. Thank you very much.
Udzielam pani głosu. Bardzo.
I now give you the floor, please.
Thank you, Madam President. Kyriakides.
Commissioner, the regulation that we're going to vote on tomorrow is an important step towards the creation of a legislative framework which will be immediately implemented by member states to ensure that they cooperate in exchanging data safely and effectively. and then it can be used to protect patients and work against epidemics. We've learned from the pandemic that no member state, no matter how strong it is, no matter how strong its economy, no matter how modern its health system, no single member state can address this situation alone without the support of the European Union, the common action of all of us together. Prevention of cancer, etc., as explained in the European draft before us, together with the Commission, is something we have to work on, and we have to work on it together between member states so that it can guide us for our future steps. Also, we have to have access to high technology, to medicine. That's crucial for us. We owe Europeans every possibility in prevention, no matter where they live, whether they're on the farthest flung islands or in the centre of Brussels. Thank you.
Thank you so much. I have given you the floor, although it was not noted that you wanted to take the floor. Thank you. And now I would like to give the floor to the Commissioner, Stella Kyriakides, please.
Thank you, Chair, honourable members. Thank you for yet another very important debate. Now, the solutions to this pandemic and other major health threats which challenge us, as some of you have already mentioned, MEP Serdas, MEP Siddle, lie in collaboration and in solidarity. And with the two rapporteurs of these important reports, we have often discussed this. And this is the way we're moving forward as a European Commission, putting forward proposals that are built on this solidarity and collaboration. The pharmaceutical strategy, the European health data space, and Europe's Beating Cancer Plan. So we must continue to take it to the next stage. The COVID crisis has shown us that we could and we can do things better and differently. Many of us seem to have forgotten where we were in early 2020. We take it for granted that we would have safe and effective vaccines, that these would be available for all member states at the same time, no matter big or small. Member states which had access to these vaccines, but 2.4 billion were also exported to the rest of the world. In fact, 2/3 of what we produced in the EU was exported to the rest of the world. This unprecedented health crisis showed the importance of what ECDC can do, but also what we needed to improve. And the cross-border threats need a different approach. So it's only right that we've designed a stronger legal framework to enhance EU capacity in the areas of prevention, preparedness, surveillance, risk assessment, early warning and response. Honourable members, with these new regulations, we've shown that we can move forward together, decisively and faster. And of course, I took note of what MEP Esther de Lange said of the importance of mental health. It remains a very high priority in this Commission, as it should do. And you mentioned cancer as well. And 2 weeks ago, we proposed the new screening guidelines with very specific targets for all member states. So this is a strong European health union we're building together, and this is how we can make this health union work for all its citizens, because they expect and deserve no less. Thank you.
Thank you so much. And now the floor goes to the rapporteur, to Ms. Véronique Trillet-Lenoir. 2 minutes, please.
Madam President, Madam Commissioner, dear colleagues, as you said, this legislative proposal and the revision of the mandate of the Health Union and the ECDC is a major contribution to the health union that we've been building step by step since the start of this Parliament. I'd like to thank the negotiating team with all its members. We've defended this regulation with a title which is not immediately understandable, to have a European plan to respond to health emergencies. With this agreement, we respond to 74% of European citizens who would like to have more European competences in terms of health and crisis management. This construction, dear Stella, will move ahead with the revision of pharmaceutical legislation through which we want to move towards a true Europe of medicines. But this legislative recast is just a start. Our plan will move ahead with a future convention on the revision of European treaties. And we are happy that the Commission, I'd like to thank them for their support through this trilogue, will be prepared to meet this challenge. Dear colleagues, by your vote tomorrow, you can convince the Member States of the relevance of a proper European policy of health beyond when it comes to national prerogatives, which have shown their limits or even their harmful effects. The health shouldn't be seen by a blow, but rather a sustainable development for the better health of citizens in Europe. So, in their name, I'd like to thank you for your support.
Bardzo dziękuję, pani poseł.
Thank you so much. And now the floor goes to the rapporteur, to Ms. Joanna Kopczyńska. You have 2 minutes, please. President, dear Commissioner, ladies and gentlemen, thank you for all your comments. Thank you for this intense and reliable, very good work. I would like to thank the Commissioner, Stella Kyriakides. Thank you for this proposal for regulation as part of the EU health package. Thank you for helping us with budgetary issues of the agency. I would like to thank the Slovenian presidency. Thank you for these negotiations in various technical meetings. Thank you to the Council as well. Thank you for being open. Thank you for remaining flexible in our negotiations. And once again, thank you to shadow rapporteurs. Thank you for being focused on work and constructive issues. I would like to thank and congratulate the rapporteur on the regulation on cross-border challenges, because it gives us hope that the synergy will be achieved between national and EU funds, and at the same time our regulations do not overlap. And I have to say, having listened to you, I agree we could have done more. It's basically always possible. But still, Benjamin Franklin said once that the best doctors give the least medications. And let us follow this principle, as I'm a doctor, physicist myself, and I tried to work out solutions, etc., and synergy between ECDC, the Commission, and Member States, while at the same time bearing in mind what we really can do. When I worked on the ECDC regulation, I focused on key elements when it comes to better readiness, better data reporting, and reliable risk analyses. And you shared my view that this is of key importance. I deeply believe that the proposed changes enlarge the mandate significantly, and it will become more operational, and thus will be able to make sure that our citizens are safer. Thank you. Thank you so much. And I now close this joint debate, and the voting will take place tomorrow.